Bulimia nervosa, often simply referred to as bulimia, is an eating disorder characterized by a cycle of binge eating followed by compensatory behaviors such as vomiting, fasting, excessive exercise, or the use of laxatives. It's a bit like being on a roller coaster, but not the fun kind. Individuals with bulimia may eat large amounts of food in a very short period, often feeling out of control during these binges. Then, they try to get rid of the calories they've consumed in a way that's both physically and emotionally damaging. The binge purge cycle is not just about overeating and dieting. It's often driven by a deep-seated fear of gaining weight and a distorted body image. Despite often being of average weight or even underweight, individuals with bulimia may see themselves as overweight and feel intense shame or guilt about their eating habits. This disorder affects people of all ages, genders, and backgrounds, though it is most common among young women. Causes of bulimia nervosa. Understanding why bulimia occurs isn't straightforward. It's like trying to solve a puzzle with many missing pieces. However, several factors are known to contribute to the development of bulimia. Firstly, genetics can play a role. If someone in your family has an eating disorder, you might be more likely to develop one yourself. This suggests that bulimia can run in families, indicating a potential genetic predisposition. Then there's the influence of personality traits and mental health. People with bulimia often have certain personality traits, such as perfectionism, impulsivity, or low self-esteem. Mental health conditions like anxiety, depression, and obsessive-compulsive disorder, OCD, are also commonly linked with bulimia. It's a bit like a perfect storm where various psychological factors converge to increase the risk. The societal pressure to be thin can't be ignored either. We live in a world where slimness is often equated with beauty and success, bombarded by images of perfect bodies on social media, TV, and magazines. This relentless cultural pressure can lead to body dissatisfaction and unhealthy dieting practices, which might trigger bulimic behaviors. Family dynamics and childhood experiences can also play a part. For example, people who have experienced trauma, abuse, or significant stress during childhood may be at higher risk. Similarly, growing up in an environment where there's a lot of emphasis on appearance, weight, or dieting can contribute to the development of bulimia. Symptoms and how they feel. Living with bulimia can be an intense and exhausting experience. The symptoms of bulimia nervosa are both physical and emotional, affecting many aspects of a person's life. The binge eating episodes can feel uncontrollable. During a binge, individuals may consume large quantities of food, often eating faster than normal and until they feel uncomfortably full. This can be accompanied by a sense of numbness or dissociation, as if they're on autopilot. After the binge, there's usually an overwhelming sense of guilt, shame, and fear of weight gain. To counteract the binge, people with bulimia engage in purging behaviors. This could involve self-induced vomiting, which can be physically painful and damaging to the body. Other methods include misusing laxatives or diuretics, fasting, or excessive exercise. These behaviors are attempts to undo the binge, but they only provide temporary relief and often lead to a vicious cycle. Physically, bulimia can cause a range of health problems. Frequent vomiting can lead to sore throats, swollen salivary glands, tooth decay, and acid reflux. Laxative abuse can cause chronic digestive problems and electrolyte imbalances, which can be life-threatening. Over time, the physical toll of these behaviors can lead to more severe issues like heart complications, kidney damage, and osteoporosis. Emotionally, bulimia is often accompanied by a host of negative feelings. There might be constant worry about body shape and weight, leading to poor self-esteem and body dissatisfaction. The secrecy and shame surrounding bulimic behaviors can lead to social isolation and difficulties in relationships. It's not uncommon for individuals with bulimia to struggle with feelings of anxiety, depression, and hopelessness. How is bulimia diagnosed? Diagnosing bulimia nervosa is not always straightforward, partly because individuals with this disorder often go to great lengths to hide their behaviors. However, healthcare professionals use a combination of methods to diagnose bulimia. The first step usually involves a thorough medical and psychological evaluation. This might include questions about eating habits, weight history, and any purging behaviors. The doctor may also ask about the individual's thoughts and feelings regarding their body and weight, as well as any history of mental health issues. In addition to the interview, doctors might use specific diagnostic criteria from the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which outlines the symptoms and behaviors associated with bulimia. According to the DSM-5, a diagnosis of bulimia nervosa requires recurrent episodes of binge eating, followed by inappropriate compensatory behaviors to prevent weight gain, occurring at least once a week for 3 months. The individual's self-evaluation is unduly influenced by body shape and weight, and the behaviors do not occur exclusively during episodes of anorexia nervosa. Doctors may also perform physical exams and lab tests to assess the individual's overall health and rule out other medical conditions. This could include blood tests, electrolyte tests, and checks for signs of physical damage caused by purging behaviors. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. So, how is bulimia treated? Treating bulimia nervosa is a multifaceted approach that aims to address both the physical and psychological aspects of the disorder. It's like piecing together a complex puzzle where each piece is crucial for recovery. One of the mainstays of treatment is psychotherapy, with cognitive behavioral therapy being particularly effective. CBT helps individuals identify and change the negative thought patterns and behaviors that contribute to bulimia. For example, it might involve challenging distorted beliefs about body image and weight and developing healthier eating habits. CBT can also teach coping strategies to manage stress and emotions without resorting to disordered eating behaviors. Interpersonal therapy is another therapeutic approach that can be beneficial. IPT focuses on improving interpersonal relationships and communication skills, which can help reduce the feelings of isolation and improve self-esteem. It targets the social and relational factors that might be contributing to the eating disorder. In some cases, medication might be prescribed to help manage symptoms, particularly if there's a coexisting mental health condition like depression or anxiety. Antidepressants, such as selective serotonin reuptake inhibitors, are commonly used and can help reduce binge-purge behaviors. Nutritional counseling is also an important component of treatment. A registered dietitian can help individuals develop a balanced eating plan that meets their nutritional needs without triggering binging or purging. This can involve education about normal eating patterns, the effects of starvation and purging on the body, and strategies for managing cravings and hunger. Support groups and family therapy can provide additional layers of support. Support groups offer a sense of community and understanding, where individuals can share their experiences and learn from others who are going through similar struggles. Family therapy can help improve family dynamics and support systems, ensuring that loved ones are involved in the recovery process. Finally, medical monitoring is essential, especially in the early stages of treatment. Regular checkups with a healthcare provider can help monitor the individual's physical health, address any complications, and ensure that they're on the right path to recovery. Living with bulimia and moving towards recovery. Recovery from bulimia nervosa is a journey, often with its ups and downs. It's not about achieving perfection, but about finding a healthier, more balanced way of living. It involves learning to listen to your body, recognizing and challenging harmful thoughts, and developing healthier ways to cope with emotions and stress. It's also important to build a strong support network. This could include healthcare providers, therapists, supportive family members, and friends who understand and support your recovery journey. Self-help strategies such as mindfulness practices, stress management techniques, and self-compassion exercises can also play a crucial role in recovery. If you or someone you know is struggling with bulimia, it's important to seek help. Bulimia is a serious condition, but with the right support and treatment, recovery is possible. Remember, reaching out for help is a sign of strength, not weakness. You're not alone in this, and there are many resources and people who can support you on your journey to recovery. Now, we want to hear from you. Do you or someone you know have bulimia? How are they treating it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.